Ask the Muscle Whisperer.
Looking ahead at 2021, we obviously start the year with the continuation of the pandemic, and we receive news that we're in a difficult phase. But let's not lose hope. Let's look ahead and think about how we can convert the pandemic into options and ways forward, opportunities for growth. So within the field, at the moment, many of us are facing that difficult choice of whether we do see our clients, whether we can argue or reason in terms of evidence base that the care we give is aligned with health care and is critical or essential. But more importantly, let's look at where our services are most required. And I think if we look at what the frontline healthcare service, the National Health in the front line are doing, they are the ones who are crying out for our help. They are working long shifts. Their diets are not great at the moment. So the opportunities lie within us being creative, within us thinking about the opportunities of wellness and how we can marshal our skills and utilize our skills in the most effective way to impact on those who require it most. So this is a chance to really think about how we move ourselves forward, how we create a workforce, and how we measure the benefits of giving. In other words, we need to strengthen the healthcare services, and our role is critical. If we were able to set up wellness clinics, to engage with multiple trusts, and to think about how nursing staff, how healthcare staff could benefit by upskilling, by receiving, by thinking about the positive effects of our work in changing mood states, in changing the way they think about work, in distracting them from the traumatic experiences that many of them face, to give them some quality time out. Even the sense of touch is so important in calming those nerves, those fears, those feelings of loss, anxiety, and burnout. And I think this is the time where we could really start thinking about how we could engage both with hands-on work, but more importantly, how we can engage by advisory, by writing, by thinking about developing a podcast that could educate about the benefits, that could be seen as a trigger during the pandemic phase, but more important, the longer phase, the value and reach of the work we do. So the advice that I would like to give us all is that we don't need to lose hope, but just reshape hope. In other words, reshape the way we think and work, to strengthen our pull, to think about how we can align ourselves more effectively with healthcare, because I think the pandemic crisis has forced us or encouraged us to start thinking about our practices in a healthcare model, and that's a really positive way forward. It's moved us into a way where we now risk assess, we now work in smarter ways, we now use evidence-based approaches to justify and reason why our work becomes important. And more so than ever, yes, COVID is there. Long-term effects of the pandemic will be there for longer than the acute phase, as we well know. So how can we combat that? How can we be present in terms of fighting the long-term effects? And how can we build our practices whereby we support, but at the same time we partner national health services? And that, I think, the best advice is to look deep inside, reflect upon where we've been, but more importantly, how we learn from the lessons of the last year and how we can grow and help others grow at the same time. And together, I think our work will be better received in terms of reshaping, realigning, and strengthening healthcare. And I think our hope is, what part do we play in changing that mindset about the work that we do. How do we rebrand ourselves? How do we market ourselves? How do we challenge ourselves to upskill, to learn different skills, and then share that experience with others? Best of luck for 2021. I see this as a really positive, engaging, and probably transformative year ahead.